Here we go. Frequently asked questions. So we've broken these frequently asked questions into 3 main categories. One is planning and logistics. The second is learning and teaching. And the third is health and safety. And so if you'll just for a moment bear with me, I have to do a virtual teaching faux pas and make sure that my Wi-Fi internet doesn't shut down from low battery. One moment. Okay, thank you for living with me, everybody, throughout the real pandemic. Here we go. So in these 3 categories, here are the frequently asked questions that I'll endeavor to answer now. Very common question is, why would you go straight, say, from the distance learning we're doing to an in-person model? Why not trial a hybrid model? And so the short of it is, throughout the, let's see, 12.5 school districts where I've had the opportunity to have an in-depth conversation and informational interview with the school leader or the principal at other sites. So 17 folks that I've been able to talk to in depth. And throughout our research, we've identified that implementing a hybrid model is not only no easy task, but is often really disrupts the quality of education for both on-site and distance learners. And so educators doing 2 different jobs is not a realistic strategy in order to solve the problem of how do we improve education for kids. And there's more, I would say, it's not just 2 separate jobs, but more than twice the complexity to try to meet the needs of both distance learners and on-site learners. And so we're not looking at trialing a hybrid model at this point. We are looking at staffing appropriately to meet the divergent needs of our current community. Secondly, why are we talking about sending students back to school when we're in the middle of an active pandemic? I think this is not only a reasonable question, but one of the most common sense places to begin. I will identify that the announcement on December 16th by the governor of Minnesota was really, could have been, say, a 3-day workshop on how, why, and when. It, in fact, was, I believe, 6 minutes or less of the announcement made on that 1 p.m. December 16th news conference. And what we've learned since then through our research, through talking with the Department of Education and Health, and then also looking at the scientists and health experts who have advised the state of Minnesota, is that the best data currently shows that ages 9 or 10 and younger have a much lower incidence and likelihood of either contracting the contagion, passing on COVID to adults, or being vectors of passing the disease to each other and bringing it home. And so on that basis alone, the Department of Health also knows that the prevalence of COVID-19 in the state of Minnesota is looking to not only be currently high, but it will remain high in populated areas for quite some time, meaning the cases per 10,000 model that was previously being used, where we were being told to see 30 cases per 10,000 or 20 cases per 10,000 as a way to measure safety in our classrooms, is going to stay high and actually doesn't accurately tell you how safe your elementary classroom is. So the combination of the low incidence of contagion being passed by those younger students, age 10 and under, combined with the knowledge that infection rates per 10,000 will likely remain high and don't correlate to classrooms, means that the state changed its guidance and then left it to schools to explain to the community how and why we would adjust our behavior. So while we are in an active pandemic, I believe what's being weighed here is the cost to children in not being able to be in person, especially our youngest students, versus how can we measure local health data. And so I'll get to this in a moment about how we're testing on site and other safety measures, but I believe that we're talking about students going back to school because the state is saying, measure locally the safety of your elementary classroom, and if you can implement that model safely, then do so. Okay, so teaching and learning questions, learning and teaching. 1, will the classrooms look how we expect Montessori classrooms to be? What about shared spaces like bathrooms? So this is where the manual that we sent out at the beginning of the year, all of those safety protocols not only are enforced, but secondly, in terms of shared spaces like bathrooms, I'm starting with the second half of this question first, we are going to go back and look at the newest health guidance and make sure that we keep the most stringent health guidance that is applicable for the ages we have. And we would manage those shared spaces like bathrooms, hallways, drinking fountains, the way that we've managed them currently. And successfully we've managed where even when there are positive COVID cases on site, we don't have any evidence that there's been any community transmission of those cases because we believe of our mitigation practices so far. Secondly, when we go back for in-person instruction from trained Montessori guides, like the ones who are your students' guides now, the classrooms would look like Montessori classrooms. For the expansion of our Student Resource Center, the classrooms will not look like traditional Montessori classrooms. So we are expanding the Resource Center so that students can get classroom experience, the socialization of learning in a group, but they will still be receiving distance learning lessons from their guides as we do distance learning. When we shift the model through a big announcement and very clear benchmark meeting criteria, that's when we will shift to on-site Montessori instruction. Secondly, if our family decides to remain in distance learning, would my student be assigned a different guide? As long as we're doing our instruction through distance learning, your student will be receiving instruction from the classroom guide you've come to know and respect and understand and love. If we move to in-person instruction because we've met all the benchmarks, and then your family still decides to be in distance learning, that's okay. We aim to have them still be connected to the classroom community through virtual attendance, to community meetings and groups. We still also intend to have them connect with their known classroom guide and assistant for student conferences and providing that time for teachers to do those conferences. But we want to be really clear that at a certain point over the long term, and I'm asking really everyone here to take a long-term understanding view of the divergent needs of all students, that if your family needs to stay in distance learning and we've met those other benchmarks though, and we can benefit students by having them do in-person instruction, we are going to make sure that the highest quality direct instruction available that we can possibly find is available to your distance learner as a supplement to the learning relationship they have with their teacher. So we're not trying to replace that relationship, but we're making a realistic understanding that the classroom teacher cannot continue to do both in-person instruction and distance learning at a high level of success. I know there are questions. I'm going to get to them pretty quick. But I'll finish with these three really common questions about health and safety. One, what sort of COVID testing would the community have access to? Right now, we have access to testing for all employees every 2 weeks, starting Monday the 18th. I wish it was more. I understand that is not at the rate that can prevent necessarily all community spread and infection among our staff who might be exposed in the community, but it does give us a baseline to know if the virus has prevalence among our adult staff and could give early indicators on how we can take steps to prevent that spread. What social distancing and guidelines would be enforced? One is that masks and shields are something we're looking to implement very soon on campus for anyone working directly with students, and that we will follow the distancing guidelines released by the Department of Health. And three, would staff be vaccinated before and return to in-person learning? And so I will be very clear here that we as a school administration are nowhere near the front of the line to get information about vaccines, though I call often, and we're trying to get as far really into the information availability as we can. I look forward to learning when we can access a vaccine for all of our educators. I know educators are near the top tier for who's going to get the vaccine, but there are no current dates about when we get it. Secondly, our current benchmarks that we need to assess about starting with lower elementary learning, those 4 benchmarks I talked about, we haven't yet established how or if a vaccine is part of those metrics. And I just need us all to understand that a vaccine, while it is a critical tool in fighting the long-term impact of this contagion among humanity, is not the end of the story. A vaccine is not a simple snap your fingers and now everyone's ready to go back to work and back to school in person. A vaccine, while important, requires additional safety practices, additional mitigation, probably the continuance of both masks and shields, at least for this year. In addition, the continuance of social distancing and really thorough hygiene and sanitary practices. And so the anxiety about returning to school for families and students is also not solved by adults getting a vaccine. And we expect that the pandemic will continue for many months. And so We need to assess the safety of educating our students, and a vaccine is a part of that, but not the simple yes/no switch. So we have to establish whether even not a vaccine is the deciding factor in one of our benchmarks, much less a component of it. And so currently we've been successful at limiting community spread of the virus, as I've said. And what we're really going to look to do is double down on both the analysis of our safety practices, the analysis of the new guidance, the incorporation of vaccines and when we might get them, and then really understanding that educating our students, a vaccine may allow us to do it easier, but is not necessarily the only deciding factor in how we go forward.